Assalamu alaikum. I am Dr. Moushumi Taher Asha, Associate Professor, Department of Anatomy, Bashundhara Ad-din Medical College. Today, I am going to discuss about the cranial nerve. Students, we have already discussed about first, second, third, fourth and part of the fifth cranial nerve, that is the trigeminal nerve. Now, I am going to discuss the rest of the cranial nerves. We already know that the trigeminal nerves has three divisions, that is the ophthalmic, maxillary and the mandibular division. We have already discussed about the maxillary and the ophthalmic division of the trigeminal nerve. Now, I am going to discuss about the mandibular division. The mandibular division is the mixed nerve, that is it carries both motor and sensory fibers. The sensory fibers are the general, somatic, afferent. These carry sensation from the skin of the cheek, skin over the mandible, side of the head, teeth of the lower jaw, temporomandibular joint, mucous membrane of the mouth and anterior part of the tongue. And the motor is the spatial, visceral, efferent, that is the muscles of mastication, mylohyoid, anterior belly of the digastric, tensor veli palatini muscle and tensor tympani muscle. The spatial, visceral, efferent sensation means those are the muscle derived from the pharyngeal arches or branchial arches. These all are supplied by the mandibular division of the trigeminal nerve. That is the first pharyngeal arch nerve. Opening within the skull, it passes through the foramen ovale. This is the picture of the trigeminal nerve. This is the distribution of the trigeminal nerve, ophthalmic division, maxillary and the mandibular division. This is the when there is a lesion occur within the trigeminal nerve, that is known as trigeminal neuralgia. Trigeminal neuralgia, the cause is unknown. Symptom is the severe stabbing pain over the face. Pain is felt most commonly over the skin area innervated by the mandibular and maxillary division. The sixth cranial nerve is the abducent nerve. The functional component of the abducent nerve is the general, somatic, efferent. All muscles of the eyeball, that means the extraocular muscle supplied by the oculomotor nerve, except two muscles, lateral rectus and superior oblique. The superior oblique is supplied by the trochlear nerve and lateral rectus supplied by the abducent nerve. So, oculomotor and abducent and trochlear, these all are the supplied to the extraocular muscles of the eyeball. The abducent is supplied to the lateral rectus muscle which turns the eyeball laterally and it passes through the superior orbital fissure at the base of the skull. If there is a lesion occur within the abducent nerve, the unopposed medial rectus pulls the eyeball medially and there is also occur diplopia. This is the figure of the abducent nerve which supplies the lateral rectus muscle. This is the abducent nerve. Facial nerve. Facial nerve is also a mixed nerve, that means it carries both motor and sensory nerve. There are some facial nerve nuclei. The main motor nucleus, the parasympathetic nucleus are the superior salivatory nucleus and lacrimal nucleus, and sensory nucleus is the nucleus of tractus solitarius, This is the distribution of the facial nerve. It supplies the motor nucleus, this passages through it supplies the all muscles of the face of facial expression. This is the pathway of the facial nerve. Functional component of the facial nerve. Spatial, visceral, efferent, that is the motor supply. Spatial, visceral, efferent. Muscles of the face and scalp, stapedius muscle, posterior belly of the digastric and the stylohyoid muscle, spatial visceral efferent. It also comes from, these muscles are also comes from the second pharyngeal arch, and facial nerve is the nerve of the second pharyngeal arch or branchial arch, that is why it supplies these muscles. The parasympathetic supply is the secretomotor supply, that is the general visceral efferent, general visceral efferent. It supplies the submandibular and the sublingual salivary gland and the lacrimal gland and glands of the nose and palate. Spatial visceral efferent, the taste sensation from anterior 2/3 of the tongue except the valate papilla and from the floor of the mouth and the palate. And general sensory efferent, it carries sensation from the skin of the external ear and passes through the internal acoustic meatus, facial canal and stylomastoid foramen. The facial nerve lesion is the two types, upper motor neuron lesion and the lower motor neuron lesion. In the lower motor neuron lesion, this is very important for your professional exam or for your diagnosis of the patient, that is the Bell's palsy. Then 8th cranial nerve is the vestibulocochlear nerve. This vestibulocochlear nerve has two components, vestibular part and the cochlear part. Vestibular part is the spatial sensory afferent, spatial sensory afferent, this is a sensory nerve. It carries sensation from the utricle and saculi and the semicircular canal. It maintains the position and movement of the head and it passes through the internal acoustic meatus. And the cochlear part of the vestibulocochlear nerve, it also carries sensation, is the spatial sensory afferent. The function occur at the organ of Corti. The main function of the cochlear nerve is the hearing and it passes through the internal acoustic meatus. There are some auditory neural pathway, how we can hear the voice. First order neuron present within the spiral or cochlear ganglion, which is located within the cochlear modulus. These neurons are the bipolar neuron. Second order neuron is the ventral and dorsal cochlear nucleus, and the third order neuron is the dorsal nucleus of the trapezoid body and the superior olivary nucleus. And the neural pathway for balance, that is the vestibular pathway. The first order neuron presents of the bipolar sensory neuron from the vestibular ganglion, which is located at the bottom of the internal auditory meatus. The second order neuron is the vestibular nuclei and the third order neuron is the thalamus. Ninth cranial nerve is the glossopharyngeal nerve. The glossopharyngeal nerve is the motor and the sensory nerve. The glossopharyngeal nerve has few nuclei. The main motor nucleus is named as nucleus ambiguus. Parasympathetic nucleus is the inferior salivatory nucleus and the sensory nucleus is the nucleus of tractus solitarius. The motor function of the glossopharyngeal nerve, it carries spatial visceral efferent fiber and supplies stylopharyngeus muscle which assists swallowing. The stylopharyngeus muscle is the only muscle which comes from the third pharyngeal arch. This is the only muscle which is supplied by the glossopharyngeal nerve, because the glossopharyngeal nerve is the nerve of the third pharyngeal arch or branchial arch. Secretomotor or parasympathetic supply component is the general visceral efferent and function is the parotid gland. And the sensory is the general visceral efferent, spatial visceral efferent, general somatic efferent. General sensation and taste sensation from posterior 1/3 of the tongue and the pharynx. Carotid sinus is the baroreceptor and the carotid body is the chemoreceptor and it passes through the jugular foramen. This is the pathway of the glossopharyngeal nerve and how it supplies the different organ and the muscle. When there is a lesion occur within the glossopharyngeal nerve, there is a loss of gag reflex, loss of general sensation in the pharynx, tonsil and posterior one third of the tongue, loss of taste sensation from the posterior one third of the tongue, hypersensitive carotid sinus syndrome, that is syncope. That is all for today. Thank you.